Thank you, Sylvia. Hi, everyone. Again, my name is Katie. Welcome to our webinar today on highlighting community partnerships. Today, we're really excited to be highlighting the South Carolina Agricultural Worker Health Program and how they are increasing access to care for ag workers through collaboration. This webinar is presented by the National Center for Farmworker Health in collaboration with the Ag Worker Access Campaign. So for those of you who may not be familiar with NCFH, we are a private nonprofit organization located outside of Austin and Buda, Texas. And our mission is to improve the health and well-being of farm worker families. And we do this by providing programs, trainings, and technical assistance and resources. And we're very proud to be able to serve the over 174 migrant and community health centers in our network who provide primary care services to agricultural worker families. And just a quick overview of our learning objectives today. By the end of this webinar, you'll have learned about the importance of collaboration and strategic partnerships for increasing access to care for the ag worker population. We'll explore health center specific and health center applicable resources that can support your collaboration and increase access efforts. And you'll increase your knowledge about the Ag Worker Access Campaign, our upcoming campaign events, and available resources. So before we pass it off to our speakers, I wanted to share a little bit about what the Ag Worker Access Campaign is. The Ag Worker Access Campaign is a national initiative to increase the number of migratory and seasonal agricultural workers and their families served in health centers. There are estimated 4.5 million migratory and seasonal agricultural workers and their family members that currently live in the U.S. This special population is so integral to the health and well-being of our families and to the U.S. economy, and often does not have access to the basic health care for themselves and their families. 60 years after the passage of the Migrant Health Act, Ag Worker Health champions continue to work to ensure access to quality health care for ag worker families through the Ag Worker Access Campaign. This campaign began in 2015. It's a national effort to increase the number of migratory and seasonal agricultural workers seen in health centers across the country. Our goal is to increase the number of ag workers served in health centers to 2 million. So you can see on this slide, since 2014, we've seen progressive increases in the number of ag workers served in health centers. Up until about 2020, we took a little dip, likely due to COVID-19 and all the impacts on health centers and ag workers. But we're very excited that the 2021 UDS data showed that we once again have surpassed our 1 million milestone. So we're very grateful and congratulatory to the health centers and ag worker serving organizations that contributed to this great milestone. And we're looking forward to seeing that 2022 UDS data later this summer. So the campaign focuses on 4 main things: understanding and addressing the unique needs and barriers of this population to accessing healthcare, ensuring that health center staff can receive the training and technical assistance they need to effectively outreach and accurately classify and report ag workers in their UDS reporting, identify and disseminate promising practices for increasing access to care, and supporting local, regional, and state coalitions between health centers and other ag worker serving entities. And the campaign is led by a national task force. The task force is comprised of representatives from health centers, primary care associations, national training and technical assistance partners, and other organizations representing education, housing, and labor that guides the direction of the campaign. And a big focus this year of the campaign task force has been supporting collaboration and coalition building and identifying and disseminating promising practices related to partnership and collaboration building. So we're very excited to have this webinar today to highlight the South Carolina Agricultural Worker Health Program, to do just that, to share their strategies and successes and challenges and how they overcame them in better reaching and increasing access to care for South Carolina's agricultural workers. So without further ado, let me introduce our speakers today. We have Elizabeth Avila, who's the program manager for the South Carolina Agricultural Worker Health Program at the South Carolina Primary Health Care Association. She oversees the day-to-day functions of the program. This program serves over 2,200 agricultural workers and their families throughout targeted areas of South Carolina each year. Ms. Avila is bilingual and has been employed with the program for over 10 years. During her initial 2 years, she worked as a part-time outreach worker before transitioning into a full-time position that has spanned over the past 8 years. Ms. Avila comes from an agricultural worker family, which allows her to understand the barriers and struggles that this population faces. We also have Martha Granados, who's the Outreach and Administrative Assistant at the South Carolina Agricultural Worker Health Program, where she supports voucher contractors by marketing and rendering COVID-19 services to the agricultural worker community and provides administrative and data entry support for the program. She's also fully bilingual and has previously worked for a community health center in the PD region of South Carolina, where she found her passion for helping this population. Ms. Granados also comes from an agricultural worker family, which, like Elizabeth, allows her to understand the barriers and struggles that this population faces. So now I'm going to turn it over to our great speakers. Thank you so much for being here.
Thank you, Katie, so much for that introduction. Hello, everyone. Thank you for having us today. We'll go ahead and get started. Like Katie said, we are the South Carolina Agricultural Worker Health Program. We are housed in the Primary Health Care Association in Columbia, South Carolina. And I also have Martha Granados here with me today. She's our outreach and administrative assistant, as Katie gave you a little bit of details about her. So next slide, Katie. So just to give you a little bit of information about our program, our mission is to improve the health status of the migrant and seasonal farm workers and their families here in South Carolina by providing and promoting culturally and linguistically competent health care and health related services. And next slide, Katie. And as we mentioned, we are housed in the Primary Healthcare Association. So we are somewhat like a community health center, but we are a voucher program. So we have a total of 5 staff. And Carlo Victoriano, who is in here, he's representing us today as well. He is our director, and then myself, of course. Then we also have Leo. I think Leo is in here as well. He is our outreach specialist. He oversees 6 outreach workers or outreach contractors. Again, because we are a voucher program, we contract out for outreach services. And all of our outreach contractors work for community health centers and are fully bilingual. Then of course, Martha. And then we also have a program assistant. She's Miss Ellen. And she's very helpful and always helps with our events. So 3 out of our 5 staff are fully bilingual. So that'd be myself, Leo, and Martha. And as Katie mentioned, Martha and I are children of agricultural workers. So we definitely understand, what our families went through and what our agriculture workers go through on a day-to-day basis. And we understand the importance of helping them, seek services that they well deserve. Okay, next slide, Katie. So like I was saying, we are housed at the South Carolina Primary Health Care Association. We became the Primary Health Care Association became our grantee back in 2004. We were formerly known as the South Carolina Migrant Health Program. So some people you'll hear say Migrant Health Program, South Carolina Migrant Health Program. But because of the name migrant, just, could be taken many different ways, we decided to change our name a couple of years ago to the Agricultural Worker Health Program to avoid, the word migrant being taken in a bad way. Like I said, we are a voucher health program. We do utilize a fee-for-service provider network, and so we have comparable rates to Medicaid, and we have over 25 local or private healthcare providers, and we also contract, the majority of them are community health centers, but we do have some private mom and pop shops. Okay, next slide, please. Okay, just to give you an idea of the services we provide or we reimburse for through our contract providers. So we cover primary care, which would be, your family practice, OB/GYN, peds. We also cover behavioral health. We do have contract with one hospital, and that's in Dillon County, so it's on 95, like almost towards North Carolina, borderline North Carolina, and that's because we've seen that the farm workers were using that hospital when they were migrating for medical services. We also have dental services. We just recently began to provide chiropractic, derma, and podiatry services through some extra COVID funding that we received. We provide vision services. We also contract, we have a contract with all of our community health centers for pharmacy services, and as well with Walmart and CVS. We cover labs and x-rays. Of course, due to the pandemic, we were in response to COVID, so we provided testing and vaccinations. And we also have contracts for MRIs and CAT scans at one provider for those who need, extra or advanced ultrasound imaging. And then also our program, like I mentioned, contracts for outreach services. And so we have outreach, case management, health education, and we also are certified application counselors to enroll agricultural workers in the Affordable Care Act or the federal marketplace. Okay, next slide. So our coverage area is the entire state, and as you can see on the map, we do have a greater presence like in the middle part of the state. And we do have more providers in the topper or the mid part of the state. We have larger concentration of agricultural workers in Aiken, Cherokee, Chesterfield, Clarendon, Dillon, Lexington, and Newberry counties. And you can see all of those on the map. And you'll see we only have one administrative site, so that's our little blue diamond up there. And then our red circles are all of our contract providers or our voucher sites. So they see our patients and we will reimburse for the services. And then you'll see the little gold stars or yellow stars. Those are community health centers who received or are a migrant grantee, so they receive migrant funding to serve the agriculture workers in their area. Now, we don't provide services in those grantees areas, but we do fill in the gaps when an agricultural worker needs services that center possibly does not offer. And so, to give you an example, we have one in like in the middle part of the state that does not offer vision, but we actually have a vision provider that we are in contract with in their coverage area. So their workers utilize our vision when needed. So that's a good partnership that we have with our migrant grantee partner. Okay, next slide, please. Okay, so this will get us a little into how the program or us as staff increase access to care through collaborating with our partners, and just to give you guys an idea of how we work here at the program or how we partner with other like agriculture worker serving organizations. Okay, next slide. Okay, all right, so the benefits of collaborating and partnering with other organizations who serve the same population as you. So, I mean, why would it be important and why is it useful? Of course, to better serve your population. You guys are all serving the same population. Why not offer them an array of resourceful services at the same time? Encourage them for self-advocacy. Encourage them to say, these services are available to me. I am eligible for them. I should be able to receive them. And also to equally distribute the work. It is a huge population to work with. There's a whole bunch of challenges that come with this population. And some organizations can help you with some of the work. It's part of their duties as well. So if we can work together and get everything taken care of at once, then why not, collaborate in partnership with them for certain situations or events. Okay. And so just to give you an idea, like bullet number 4, one of the things we do is migrant education. We partner up with them a lot, and they can provide transportation services to agricultural workers who are in their program. So if it's like an H-2A camp and you have workers who, or a worker who is eligible for their services, part of their job description is to provide transportation and to cover the health aspect of the worker as well. So if we can have one worker go, then we can have others throughout that organization or that farm if attend through transportation. So if that one worker can get transportation, then the rest of them can as well. They can tag along, and that's something that we greatly appreciate our partner for sharing. And we'll get into more a little bit details about it, but that was just one where I wanted to give an idea of like what we mean by when distribute the work equally. Like if they can do it or your partner can do it and they're willing to help you, I would definitely take that up. Okay, next slide. And so how do we collaborate? So we do it through joint outreach or joint events, by sharing resources with each other, by sending referrals through our programs, by working together, and just by being, being there for one another and being a support system for one another, and helping out when possible. Okay, next slide, please. And I will turn it over to Martha for this part.
Hi, everyone. So one of the things about collaborating with other organizations is being invited to tag along during outreach. By doing this, we're able to gain more trustability in the community. We do outreach at night clinics, during mobile events. We've also teamed up with the local consulates. One thing about them is that they like to visit farms the night before or a few days before an event, to provide educational materials to their Mexican nationals. Also, continuity of care. This is something that came from the South Carolina migrant education program put together. She said, if we're consistent, we communicate, we gain la confianza that provides more continuity of care. Once an event is finalized, we make sure that all ag serving organizations in a region are able to attend an event like our dental events that we have during the summer. Next slide, please. So these are some of the outreach events that we've had. On the first event, the first picture, it was a mobile dental event that we had last year at the East Coast Migrant Head Start project in Lodge. So East Coast Migrant Head Start allowed us to use their facilities for this dental event. Migrant Education helped us with transportation. They were able to transport several of the patients to the dental event so that they can receive the dental services. And a fun fact about this day, some of the agricultural workers from the Chapel Farms, while they were waiting to see the dentist, they were also helping La Escuelita with a lot of their to-do list. They helped change doorknobs, fixtures, hang up whiteboards, put up a flagpole. They planted flowers, so they assisted La Escuelita while they were waiting. And then the pictures 2 to 4 are several of migrant education, visiting and providing English classes to the workers. And while we were there, we also enrolled them into our program and gave them some of the information for the services available to them while they were here. Next slide. One of the things that we do is share resources on all of our social media platforms, Facebook and WhatsApp. By sharing flyers about the organizations, other agriculture community is able to see some of the resources available to them that they might have not known were available. We share all events through our stories on Facebook and WhatsApp. We talk about, we also share about organizations like a program that provides eye surgeries for some of the, I'm not going to say agriculture workers, but the community, and they do it at a low cost. And once we found out the ins and outs of the program, we immediately shared it with all the other organizations so that if they had any patients or anybody that they knew that would need a service like that, they were able to receive it as well. Next slide. By working together, you can ask somebody, ¿conoces a Marta? Have you met Marta before? It helps build that trust whenever they're meeting somebody new. In the first picture, we held a meeting with several of the ag serving organizations in the state, and we all learned different techniques and strategies that we could use during our outreach events. And we broke up into regions so that we could all share about the services that all the other organizations had that we probably didn't know about. And we also had our second annual networking meeting with the East Coast Migrant Head Start Project and the South Carolina Migrant Education Program. And at that time, we also broke into regions and we discussed several upcoming events or upcoming outreach that we wanted to do together. And then I'll let Elizabeth take over the other half.
Yes, so like Martha was saying, so we plan together and we also learn together. In the picture of the first picture at the top, like Martha was saying, it's an outreach meeting that we had. It was hosted by or given by health outreach partners, Liam and I can't remember. Help me out, Martha. What was Megan, thank you. Liam and Megan came and joined us for a whole day, and they gave us a whole day long outreach training. We had a great meeting. We all learned so much, and so we learned together, so that way that when we're out doing outreach together, our agricultural workers are you know, provided the best service possible, and we learned back, you know, at our offices how to work together. So when we go out, we are, you know, promoting the services the best way possible. And then also, the program has quarterly migrant advisory council meetings. And in those meetings, our partners, a lot of our partners are our members and guests. And every meeting, we have 2 of our partners present on their programs and services that they can provide to our agricultural workers. And then at the end of those meetings, we also have a let's share. They can take the time to tell us about upcoming events, or if there's any barriers that they want to talk about that other organizations may have already addressed. We discussed that at that time. And then also Leo, our outreach specialist, has monthly outreach meetings with our outreach contracts, where we like to invite other organizations who serve the same population as us, who we feel that, you know, would provide resourceful resources to the ag workers we allow them to come in and present during those meetings as well. And then our outreach contractors, if they have any questions about eligibility or for that program, or how a worker goes out about seeking those services, then that's discussed then. So when at the time we do present it to the agriculture workers, we know at least the basics of what they need. And then we also on a regular basis, when we have an outreach event or a dental event, a mobile unit event, when we have those already confirmed and in schedule and ready to take place, we automatically send the flyers out to our partners, which will could be migrant education, it could be the Department of Labor, it could be the East Coast Migrant Head Start Project, just whatever whatever services is available in that area, we invite them to attend the event and to promote their services and offer it their services to the agriculture workers while we're there, or while we're having the event. Okay, and I think that is it, Katie. I think that's our last slide. If anyone has any questions for us.
Thank you, Elizabeth and Martha. I'm looking in the chat here and the Q&A to see what questions we have. We have a question from Jeffrey. I'm curious to know if physical therapy has been part of your services.
It's not one of the services that our program specifically provides, but like I said, since we contract with the community health centers, if the community health center does offer those services, they can seek it from that provider at that time.
Thank you. We have another question. How do you find or identify new partners?
A lot of times it's through networking. We attend all kinds of meetings, events, and also our partners. Just to give you an idea, our partner with Migrant Education, she had met a pro bono lawyer not too long ago who was seeking, to provide services to the agriculture workers. And she called me up and said, Elizabeth, hey, I need you to meet this organization. They're trying to help agriculture workers, and at this given time we're a little we're lacking a lawyer for migrant legal services. So we looked at the options and heard what she had to say and see if there was anything we could help her with or she help us with. But a lot of it does come from networking and I mean, just when our patients need certain services, just taking the time to look for them and Google it, learn, search, research, ask around, ask your existing partners, this may be something that they've already accomplished.
That's great. Thanks, Elizabeth.
Mm-hmm.
Are there any barriers you experience in partnering with others?
I would say yes. I wouldn't say it happens often, but yes, there is barriers, and one of them would be, like, for example, with legal services. I'll use that as an example again. Going to the farm with legal services is sometimes a big no, because they are who at the end of the day can cause the farm or the farm owner would think they cause harm because they reported something they've seen, or a worker wants to sue or seek legal services. So yes, I would definitely be careful going to do outreach with them. but just make sure you know your partner very well, and know the services they're providing, and make sure it's not a conflict of interest, or it will possibly close any doors for you doing joint outreach with them. But yeah, there is some situations to where there's definitely barriers or cautions you should take when doing joint outreach with other organizations.
Thank you. And we have a couple questions here. I'm just going to keep firing them off to you too. How do you empower the farm workers when they migrate to another state or country?
So I will give a little bit of this and then I'll pass it on to Martha because she is amazing at that. We always make sure that they have our phone numbers. They always know that we have WhatsApp. So if they do go to another country and they don't have the same number, they can always use the WhatsApp, and we have WhatsApp on all of our work cell phones. And so they can always contact us, whether it's through messaging or whether it's through a call. Then the next thing we do is we tell them to like our Facebook page. Everyone has social media these days, so if they can't, for some reason they lose our number, they'll always have our Facebook, and they can always reconnect with us. And then also there is there's these little cards that we give that, through the National Center for Farmworker Health, and we encourage them, to never lose the little keychain, because they can always contact that number and reconnect with us through there as well, or find, healthcare services when they go state to state, or when they either migrate back to the United States. And then I'll let Martha cover when they go back to other countries.
What I do is just keep in touch with them. If I know that they'll be leaving within a few months, I try to stay in touch with them and figure out when they'll be, if they're returning to South Carolina, when they'll be returning, and set up a plan to meet with them as soon as they get here. Especially when they travel from state to state, I try to find out what state they're going to. If they know the city or the town that they'll be in, figure out what community health centers are in that area and what services are available to them within that area or region that they'll be in. So just staying in touch with people.
And to piggyback off of that, what Martha said is that once you build that confianza, that trust, even when it's time for some of our outreach workers or our H-2A workers to come back from Mexico, they text us a couple weeks ahead and say, hey, this is the date I have to be at the border. We should be at the camp by this date. So we can go ahead and plan ahead. The guys are coming. If they want to get their boosters while they're here, they want to go ahead and get flu shots, whatever it may be, we'll work with the outreach worker in the nearest community health center to make sure those things are taken care of. So once they get here, they're healthy and ready to work, and they know we're available if they have any health needs while they're here.
That's awesome. That's a lot of hard work, and that trust building is so key. You mentioned the little key tags that you got from NCFH. That's our Call for Health program, and we'll have a slide on that a little later if any other health centers here are interested in promoting that program in your work too. Another question here about how many patients are seen and what services are provided at your dental events.
So normally we at a general dental event, we try to schedule them either 2 to 3 days, and we can see we've seen anywhere from 45 to 60, 70 at times. And we provide just basic extractions, cleanings, fillings, x-rays if they need it. And then also, like I said, we invite our partners for them to provide services while they're waiting to see the dentist. And that could be an array of services: Telemon Corporation, Migrant Education, East Coast Migrant Head Start. We even had one organization like last year, I think, was for USC, who was doing some studies on Hispanics from countries like Mexico and below, to see if they were exposed to the Zika virus and to provide them services if they were exposed and if their test came out positive. So that was a little nice event that we could have. We've also had Pasos, which is a Hispanic serving organization here in South Carolina. And we gave away a whole bunch of promotional items, you know, some materials, health education materials. We've even had some donations from our coworkers here at the Farmworker Healthcare Association donate a whole bunch of clothes and shoes and towels and blankets and stuff like that. And, you know, if they need the items, they are more than welcome to take them at that time as well.
Awesome. We have a question here. Could you provide some more information on the networking meeting you talked about, and maybe a little bit more about those breakout groups into regions? Is there a standard agenda for that group work, or was it more casual networking conversation?
Very casual.
It was very casual. Yeah, we were at a park. It's normally at a park, especially since COVID, you know, we like to be out in the open. And it was just broke up by region. And then, you know, each organization went around the table and said, so it's the outreach workers per that organization by region. And just we went around the table and, you know, told what our programs were about and who's eligible and how we found them eligible. And the eligibility process, who they should contact. And then from there, we spoke on events, and we started planning for events. If we had any events already on the schedule, you know, the other organizations wrote it down and went ahead and penciled us in on their agendas to attend as a partner and provide their services. And then after that, we came back as a whole, and then just any challenge that any other organization was having, we spoke about it. Or if there was a group of agricultural workers that one group could reach but the other one couldn't, we try to figure out ways of introducing, you know, the ag workers, or introducing the partner, the outreach worker for that organization to the farm workers or the farm owners, however, you know, the situation may be. But it was very casual, nothing, you know, we did have a small little agenda, but it was nothing, you know, nothing major or too formal. It was just very casual. We all brought snacks, bring your own lunch type thing. And then we just enjoyed a day, you know, with partners at a park and just talk about, you know, our jobs and you know, plan ahead.
And another thing that we did was share flyers, and we made sure that each of the organizations had enough flyers that if they ever encounter somebody that they think could qualify for any of our programs, they were able to give information right away.
Awesome. Thank you. I love that. Partners at the park. I hope that's what you called it.
We'll use that one next year.
Okay, I'm checking the chat here. You're getting lots of great compliments in the chat. Any other questions? Okay. Well, I will pass it over to Lisa for the next part of the webinar.
Thank you guys so much for having us today.
Yes, thank you so much. We're going to keep asking you questions and getting your information now.
That is totally fine.
Thank you, Katie. And thank you again, Elizabeth and Marta, for this great presentation and information you shared today about your program. So now we'd like to transition over in the next slide to a group exercise that all of you joining us today can participate in. So we have a case scenario activity on the screen, and we want to work through this together. So in this scenario, you're planning an outreach event in your community for the upcoming peak season. So we want to brainstorm together on what services these families might need, and then who you might want to invite to this event. So Katie's going to pull up a Jamboard screen for us. And if you'll enter in the chat your responses, then we'll start building this little brainstorm. And then you'll get a copy of it in your slides when we conclude this event, so that you have hopefully some ideas to take back with you as you try to develop some new partnerships. So if you'll just enter in the chat, again, we're planning a kind of a welcome type event, if you want to think of it that way, for families coming into your area. And we want to think about what type of services they might need, and then who you might invite. And you can just add that in the chat, and then we'll start building our little brainstorm board here. So as we think about these families coming in, if they have children, maybe they're needing to start school. So let's think of, maybe we could think about things they might need, in order to start school, housing, what type of things would new families need as they're coming into your area? And Tasha's sharing they may need checkups, clothing, and transportation. Definitely. School supplies. Thank you, Ellen. That's a great, that we definitely would need that as well. Access to food via SNAP or local food banks. Definitely. Thank you, Jonathan. That's a great addition. COVID test kits. Definitely. So we want to welcome them to our area. They may be new to the area, so they may be unfamiliar with these resources. So again, let's think about anything they might need. Immunizations for both children and parents. Yes, definitely. Access to medical services. So we definitely want to let them know about the services that you provide as a health center. Let them know, about the services you provide, your hours of operation, just let them know that you're a resource to be there for their medical home. Cell phones, agricultural cards. And Tasha, can you add a little more information on what an agricultural card is? Toys.
Lisa, that would be for our programs. This for a voucher program. We give them an agricultural worker health card that has their information on it.
Oh, awesome. Okay, that's a great idea. Representatives from embassies from the countries and families they come from would be invited. That's a great idea. Awesome. Toys for the kids, definitely. We want them to feel welcome. Books, that's awesome. Erica shared housing. Definitely want to do that as well. Make sure they have information about available housing. So we've got lots of ideas on what they might need. What about partners? So we know we want to invite the representatives from the embassies, from the countries they come from. Who else would we invite that might provide those services that we listed, or those resources that they need? So legal services advisors, definitely. Churches are a great idea as well, definitely. That help them build, become part of the community, feel more part of the community if they are, the churches are there, anyone that can, any local groups like that. Other community health workers, definitely. That's a great idea. Schools, education programs, definitely they need to know kind of more information about what to expect. That's great. As they're trying to get their, maybe someone lets them know what all the requirements are to get registered, or if there's something they can do, any paperwork ahead of time, that'd be great. Community health center reps, of course, that's great. local food pantries. Yeah, letting them know how they can access them, have a representative there to let them know how they can access that service. Health department and programs. Thank you, Carlo. That's great. Interpreters or translators, definitely. Yes, we want to make sure that they're have access to to receive information in the language that they are most comfortable with. Definitely. Anything else? We've got a good little brainstorm started. Local farmers, that's excellent. Yes. So I want to invite those employers. And there's a, Katie asked the question, has anyone had success with partners that offer cell phones? Migrant seasonal Head Start, definitely. Migrant education, we want to, have a rep there if we can. Opportunities that promote health and not just treat crisis, exactly. Letting them know the importance of, preventive care versus just crisis care. Anything else? Is there anything we've missed? Is there one of those on the yellow side? Is there anything that we listed that we don't have a partner we've invited that we've listed as a person to invite yet? And Katie asked about the cell phones. Does anyone have a contact or someone we could invite that would provide or help with cell phones? So we definitely want to add that to the list. Elizabeth, do you all work with anybody that provides cell phones?
I don't think we have, but I do know that in order to qualify for the free cell phones, I think they either have to receive some type of government assistance, so whether it be like Medicaid or SNAP benefits. So a lot of our agricultural workers, unfortunately, are undocumented, or our ones who come on visas definitely wouldn't qualify. But maybe if the kids have the services, they could possibly get one for the family. I'm not sure, but that would be my guess or my way of going about that.
Okay, that's a great idea, something to look into for sure.
Mhm.
Yeah, we'll have to. That's a great. We'll have to look into that. Maybe add that in the resources of any research we find on that. We can definitely look into that a little bit further. And then just a thought from the chat, Carlo shared Hispanic representatives from local police department. That's a great idea. Yeah, and I know, and normally we have like here we have like a night out or something with the police where everybody kind of meets your representatives to so the kids know that they're someone to go to, a safe resource for sure, and definitely having the Hispanic representatives there would be great. And Dr. Balans shared personal safety gears, from safety boots, goggles, protective gloves, and masks. So that's something that they might need on the yellow side. And then Erica shared family support programs that address migratory stressors. Oh, that's a great resource. Definitely a need. And Marta shared clothing for sure. That's awesome. And I know you all have shared in your presentation that some of your staff provide that or gather that some clothing. That's awesome. Yeah, but definitely a need.
And Lisa, that reminds me, like if one of the things we ask for is when you say, can you make donations? A lot of people just assume it's clothes, but we have to think about those migratory families, who come here for a little while. I ran into situations where they didn't even have plates or spoons or just cups to drink out of. So, anyone trying to get rid of, some things in their house, blankets, sheets, pillowcases, pillows, of course, make sure they're clean and worth giving away. But, just sometimes think outside of just clothes, because there is other things that they may need.
That's a great point. Thanks, Elizabeth. Yeah, definitely. Yeah, they maybe definitely coming to the area with very little and kind of need to start a new home. So all those things that'll help them do that are really essential. Okay, anything else? I think we've got a good little brainstorm started here, and you guys can keep adding as we continue on. And like I said, we'll add this to the slide, so you get to take this back with you, but hopefully you all come back with, are able to take away just a couple of ideas, at least, of who you might invite to the table, as you're planning your events. Or if you're one of these folks that provide one of these services or resources, connecting with your local health center and letting them know that you're there, because they may not be aware that you're there. So not just health centers seeking out partners, but partners seeking out health centers and other like-minded organizations as well. It's all about the collaboration, as we've learned from the South Carolina program today. So I'm going to let you guys keep adding on to that in the chat, and we're going to go on and start talking about some resources as we wrap up. Want to make sure we're respectful of your time. So we do have some additional resources in addition to the brainstorming we've done and the great information from the South Carolina program. We do have some additional resources we'd like to share with you that might help you with your collaborations that you're developing. And we'll go on to the next slide. The first one is the Ag Worker Access Campaign Partner Profile. And the purpose of this tool is to assist you in identifying potential partners that can support your health center's efforts to increase access to care for your migratory and seasonal ag worker families. So it's kind of like what we just did in the brainstorm. It helps you think about all the systems in place within your area that impact the individual, the family, or the community, and consider those, so you can consider those that address your patient's social determinants of health. And those that can be community partners in your outreach efforts. So you can kind of start a list of those resources for your patients. And then when you have events, start thinking about who you're going to invite to those events as well. And that's available on our campaign webpage, and you'll receive links to all these resources following this webinar. And then the next one is a memorandum of understanding template. So this is again through the Ag Worker Access Campaign. So you can use this template to solidify your collaborations. So it's in a Word format and has some suggested activities you can do, but that way you can customize it to whatever the collaboration is that you're building and developing with your new partner. And that'll be available to you as well. And then the next one is from one of our task force member organizations, Health Outreach Partners. It's the Health Outreach Partners Collaboration Toolkit. And this is a very comprehensive collaboration toolkit. So whether you're starting from scratch to build relationships with other individuals or looking for strategies to expand your current partnerships, you can reference this toolkit. It has lots of great resources in it. And we'll share the link with you. You can go to their website and register, and then have access to this toolkit that you can pull from, again, as you build your collaborations within your organization. And then we'll go on to the next slide, please. And then another Ag Worker Access Campaign Task Force Partner Organization has shared this resource with us. It's the Effective Partnerships Guide. It's designed to help migrant and seasonal Head Start grantees and federally qualified health centers establish partnerships that increase access to oral health services for children. So again, another great resource for you that you might be able to pull some ideas from. Even if you're not working on oral health, maybe pull some of those tips and resources that they have there. So we thank our partners for sharing those resources with us as well. And then we also have in the next slide, our farm labor data dashboard. So as you're thinking of outreach in your community or working with your ag worker population, this is a great resource that you can sign up for access to. And it'll let you know about the population in your area. So you can look by state, by county. You'll find out the number of ag workers in your area. You can see by month when H2A workers are coming in your area, when those peak seasons are. So that can help you with planning your outreach activities. So lots of great information in this farm labor data dashboard. And we'll send you the link to sign up for that as well. And then our next slide. And then, of course, this webinar is in collaboration with the Ag Worker Access Campaign Task Force, and we encourage you to sign up to join the campaign. There are lots of great benefits of joining the campaign. Of course, Katie shared the purpose of the campaign is to increase the number of ag workers served in our health centers. We want to increase access to quality health care for this this population that serves us, that provides, you know, provides such an important is such an important part of our lives. You know, they feed us. So how are we going to assist them and make sure that they receive the access to healthcare that they need? So some of the benefits, of course, you're joining a national network of organizations that are committed to the same goal. You know, increasing access to care, making sure that this special population receives the healthcare that they need. You'll receive lots of great tools and resources to help you as you serve this population. You'll be able to network with members that are, again, ag worker serving organizations. You'll have access to regional customized training opportunities. There are increased access to care for ag workers program that it goes is very closely associated with the Ag Worker Access Campaign. So that's another benefit. And then, of course, you have access to technical assistance and migrant health action planning through the National Center for Farmworker Health to help you set goals for your migrant health program and work through how we can, you know, assist you with achieving those goals. So we do invite you to join this important work, to sign up for the campaign. And so Katie shared the link to join. It's very easy to get to. There's a red button at the top of the page where you can just join and sign up today and start receiving those quarterly updates and access to all the benefits. And we'll go on to the next page. And then, of course, we have National Health Center Week coming up. And we have a National Health Center Week challenge related to the Ag Worker Access Campaign. So really easy for you to earn some prizes. You sign up for the campaign, share our Facebook frame, and then, oops, I just lost my slide here, and earn some prizes. And we have details on the slide here for you, and then a link for you to join. And then we'll go on to the next slide. So I know we're coming up on time, so we thank you all for joining us today. For those of you participating live, we ask you to stay on just for a couple more minutes. We have a little more content for you. So if you'll just please stay on. And for those of you watching the recording, this ends our presentation for today. We thank you so much for joining us.